And welcome. Thank you for joining us. My name is Jennifer Bruin, and I'm the project coordinator of the Madonna University Center for Regional Economic Innovation here at the MSU Center for Community and Economic Development. We are located in Lansing, Michigan. The REI University Center is supported by the U.S. Department of Commerce, Economic Development Administration, and the Michigan State Housing and Development Authority, also known as MISHDA. It was established in the fall of 2011, and we've spent the last 3.5 years or so supporting the identification, creation, and development of innovative economic development strategies that we hope will yield high-growth entrepreneurship and job creation in mostly distressed regions of Michigan. Each year, our university center selects several innovative economic development projects, and these projects are led by experts in the field and or by faculty at higher education institutions across Michigan. And we support these projects with small mini grants to offset the costs that are associated with the research and initiative. Today, our presenter, Dr. Phillip Olla from Madonna University, is going to present his project. His student team and he worked together on a project that focuses on the health and economic costs of pollution in specifically Southwest Detroit. Dr. Olla is a professor of Management Information Systems and the director for the Center of Research at Madonna University. His primary focus area is the convergence of telecommunication and healthcare innovations. Hi there, Dr. Olla, are you there?
Hello, how are you?
I'm good. How are you?
Fine, thank you very much.
All right, and you can start whenever you're ready.
Okay, thank you. So our project is titled A Breath of Fresh Air, and that is really a subtitle that the students gave the project. Our working title really is an impact assessment of the study of health economic costs of pollution in Southwest Detroit. So a little bit of background, because the title is a little bit wordy. We're really looking at the health impact on the economics in Southwest Detroit based on the pollution. So the work was done by a student group of nursing students who are taking a technology class. So before I jump into the presentation, I'd like to thank our sponsors, the REI Center at MSU and the U.S. Department of Commerce and Economic Development Administration for supporting these mini grants. They're very, very powerful, and they really provide a great wealth of experience and research capabilities to students. So my overview, so what I'm going to discuss first is give you an idea of what the study objectives was. This was a 12-week study, so we were very limited in what we could do within that time frame. Then I'm going to provide the findings, what did the students actually find and what really stood out to them, what was the thing that kind of captured their imagination. And I'll go on by showing you a video that was created by the students, and then using infographic, which is visual representation of data, I'll kind of walk you through what the main outcomes from the research was from the students. And then the last point is actionable items. What is it that we can do to address some of the issues that were found in this study? So there's a quick overview of what we're going to be covering in the next 40 to 45 minutes. So the study was undertaken in Southwest Detroit, in particular zip code 48217. So this zip code kind of stands out a little bit because there is a lot of industry around there, and there is it seems to be a very distressed community. So the idea is to look at what is happening from a health point of view to the citizens who live within that zip code, and how does that impact their economic capabilities to earn and to progress in society. So fortunately for us, we ended up collaborating with a partner, a great partner in the Detroit Sierra Club, and they were very instrumental in deciding on where our site visit should take place. They were great educators. They could provide great background research and background knowledge, so that we were really starting from a very high point. The students were all health informatics students, so a mixture of pre-nursing, nursing, and healthcare administrative students, all in the probably the first or second year of university before moving into their program. So none of us had much of a deep knowledge of this area or any of the issues before we went into this project. So it is really a great, what I'll call, academic service learning project. So some of the things that we're able to do. So due to the financial and time constraints, we were not able to conduct primary research. So we were not able to collect actual environmental data or link the environmental data to the economics. But what we could do is we could tap into original scientific research that has been created for the zip code we are interested in. And then we can also get interviews with people from the neighborhood to give us their perspective. And we're also then able to tap into to knowledge that was currently being created by the Detroit Sierra Club. Once we had all this information, what we decided to do was to create what we call data visualizations and animations to make these issues understandable by anybody without necessarily needing to have the scientific knowledge to kind of decode the data that's coming through. So we do have a report that describes our findings, but most of our findings were presented via what we call infographics. So I will present the infographics in this PowerPoint, and I will provide the links for the infographics on the internet so that you can take a look at them and share them via social media too. So the zip code in question, 48217, is actually considered one of the most toxic zip codes in the country. I think it's probably ranks in the top 5, maybe top 3 on some scales. So there are serious concerns regarding health for the people that do live in that area. And one of the biggest issues is the impact on children and the proximity of some of these plants and factories to school. So the image you see there is an actual picture that one of our students took while we were on the what was called a toxic tour of Detroit. And you can see how close the actual school is to the plant that is sending out emissions into the environment. So it's once you do the tour, you see straight away that there are some very obvious problems. So jumping straight into it. So what did we find? So one of the most important things that we were able to find when we looked at the research, there's lots of research that was presented, particularly looking at cancer incidence and asthma incidence and skin irritations and different types of leukemia. And the one that is the most obvious once you visualize it and once you look at the data and the research is asthma. So within that community, we found that that approximately more than 29% had some incidence of asthma, which is 3 times the national average. And children within that zip code suffer both asthma and respiratory complications, which basically starts more or less from birth. So it's not something that they grow into. It's something that is that researchers and scientists believe is pollution-driven. Wayne County in itself has the highest number of pediatric asthma cases, and which is also the highest in the state. And another issue that we were also to link was asthma incidence to poverty. So there seems to be a correlation between the two within the neighborhoods that we looked at. The thing that was the biggest problem for us, that was the issue of the children's asthma, the pediatric asthma. So when we took the tour, we were fortunate, and we had opportunities to talk to different groups and different stakeholders. And one of the biggest problems was the children. The children were getting sick with asthma and having asthma attacks, and ended up being hospitalized 4 times greater than the national or state average. So what this does, it creates a knock-on effect. So your parents or the parent who has to go to work all of a sudden has to leave work and get to the hospital, take their kid to the hospital. And this is happening at such a frequent state that it's very hard for them to actually keep their employment when their kids are bouncing from school to hospital, from home to the hospital. So one of the main reasons for the poor employment stats is the fact that the children are always sick. So that was one of the anecdotal tips that we got from some of the groups that we talked to. And then another group that we spoke to was from the public health, and the Sierra Club had an interaction with them prior to our meeting, and they were very concerned about the number of children's hospitalizations in this neighborhood from respiratory diseases, and also they were also concerned about the number of absenteeism from the schools. So what they did is they ended up taking a trip to the school to interview the teachers and some of the parents about why the incidents were so high. The response from the Sierra Club, who were there, was very very comical. What Rhonda Anderson said to them is, "But how did you get here?" And they responded that we drove here and we came by car and we drove when we got here. So, and when you were driving here, did you see the industry and the pollution that you're driving through? Yeah. So right there is the potential cause of the problem that you're investigating. So to a lot of people it's very obvious, but unless you actually go into the neighborhood and you see what's available and what they're dealing with, it's very difficult to actually visualize the conditions just looking at the numbers on a piece of paper. So by taking the students there, it was a real eye-opener for all of us just to see just to get the smell and to see the proximity. It's like living within plants after plant. So pediatric asthma is really a very serious concern, and it's something that when we're looking at the economic aspect, until things like this are addressed, it's going to be very difficult for the people who live within that neighborhood to be able to pull themselves out of poverty. So income disparities was it was very obvious, and again, what a report produced by Atkins showed that it's less than $20,000 below the national average for the people living in that area, and also that area has the largest percentage of residents who have a low earning, less than $15,000 a year. So with the inability to move because the property values are so low because of the pollution, and there really is no way for them to earn within that neighborhood because the jobs are very specific, very skill-based, and people that work in this plant don't have a great life expectancy anyway, so it's not really the best place for them to work. So with these two things, it becomes very difficult for job advancements and employment for people living in that neighborhood. So I'd like to show a quick video created by the students just to give you an idea of some of the findings.
Children in Detroit are contracting life-threatening illnesses. But why, you might ask? Well, factories in close proximity to schools give off toxic gases that our kids breathe in every day, destroying their lungs. Not only do 50% more adults in Detroit have asthma than anywhere else in Michigan, but rates of asthma hospitalization are 3 times higher than that of Michigan as a whole. Hospitalizations for children is 50% higher than that of Detroit adults, and rates of asthma death are over twice as high in Detroit as the rest of Michigan. In Detroit, a greater number of babies die before their first birthdays than any other American city, a rate higher than China, Mexico, and Thailand. 15 out of every 1,000 babies die in Detroit, making it a worse infant mortality rate than Bulgaria, Malaysia, Sri Lanka, and Russia. Pregnancy-related deaths are 3 times the national average. The death rate of about 59 per 100,000 is higher than developing countries like Tunisia, Belize, and Kazakhstan. Isn't it time we did something about it? Isn't it time for Detroit to get a breath of fresh air?
And that's a very powerful video because that really does summarize the conditions that we're dealing with. And I think the good thing about that video is it puts it in context to other countries as well. So it really shows where we sit within some of those other developing world countries. So it's something that the students wanted to do because they thought by creating the video, it will give them an opportunity to disseminate their findings and what they know to a more diverse audience, other than the environmentalists, who are the only ones really who are pushing and making people aware of the environmental conditions in some of these areas in Detroit. So by doing the video, their idea was to kind of open it up and expose what's currently happening and the current statistics to a wider audience. So the other aspect of their work was creating infographics. So infographics are really visual representations of complex data. So the students worked in 3 teams because when they did the tour to Detroit, they went in separate teams because of the limitations of transportation, and just to make it as real as possible. And so the infographics we have 3 infographics that really try to focus on different elements of the tour and present it in different formats. So I'm just going to go straight into them. So the first infographic, the title is "The Air We Breathe," and the important thing to mention is the title of our project is actually called Toxic Zip Code. And once we did the tour to the area, and we heard the stories of people living in the area, and we looked at the data and the stats and the attitudes, we thought it was a serious disservice to label the project Toxic Zip Code, because that really just put a burden on the people who live there. So what they did is each group decided to come up with a different title for their project. So the first one here is called "The Air We Breathe," and it really just focuses on some of the health issues. So what their main focus was is looking at the pollutants and being able to link the pollutants that are in the area to particular diseases. So they first identified the scientific research. There's some very interesting work coming out of U of M, who have implemented a sensor network within the school, and that's collecting data. So by looking and tapping into that data, we can see what pollutants are in the air, and then by doing the research, the students are able to look at what particular health effects are created by those pollutants. So the fine dust is a big thing. Lead is a big problem. The sulfur dioxide is really one of the key culprits to a lot of the respiratory diseases. Then the heavy metals, nitrogen. And what this is really leading to is that the sulfur dioxide in the air, in the emissions, is something that we identified very early on that we have to address that. We have to do something that tries to create an initiative to try and make them reduce it. Now, unfortunately, this is very political, and as a student group, there really wasn't much that we could do. What we did notice when we started researching this is that there have been 3 past violations for carbon dioxide and sulfur dioxide infringement. So, and some of the companies have been cited 38 times over the past couple of years. So it's not that the government had set the limits and the companies were staying within these limits, and then people were getting sick. The issue is that the companies were exceeding their emissions, and the other problem was something called the cumulative effect. So each company may have a limit on what they can emit. And don't get me wrong, it's not that they were keeping to those limits. So each company had a limit to what they could emit, but no one was taking it into effect, the fact that you have 5 companies around a particular neighborhood or a school, and the cumulative effect of that is what is causing those serious illnesses. So the asthma, the heart failure, chronic lung disease, pneumonia, so a lot, and then the low birth and cancer. So these are some of the things that that the neighborhood is seeing at alarming rates, and these are the diseases that are contributing to making Detroit's numbers high, and a lot of it can be attributed to the pollution and poor education on the part of some of the residents. So on the next slide of the infographic, the students decided to title this infographic "Clearing the Air." So again, let's move away from the idea of labeling the citizens toxic to coming up with something more positive. So again, what they've done is identify the key companies within that zip code, and look at the number of residents. So we have 82,000 residents and 25 industrial warehouses, oil, gas refineries, waste management. So that is a lot of things to pack into one area, especially when it's a residential area with children and schools and people living. So it's identifying the main culprits is important, but not pointing a finger at any of them. And the next thing they did is they really looked at what are the actual levels of pollutants in the air, and so this kind of gives you an indication of how bad things are. And just to give you another idea, because looking at those numbers themselves, it's very difficult to know whether they're high or they're low, and it was almost impossible for our students to be able to benchmark these, because the way the companies release the data is done in a way that it's not a transparent way to be able to monitor and to compare and contrast. So the only thing that they could do to really give an indication of what those numbers look like from a pollution point of view is look at what is called a toxic burden score. And if you look at Michigan, our toxic score is around 56. It's not great, not bad, somewhere in between. But if you look at the particular neighborhood we're looking at, the toxic score is 2,576. So it's more than off the charts. I mean, it's in space when you try and draw a graph. So that is one of the good things that came out of it. It really highlighted the divergence of where we should be and where we are within that neighborhood. And the video clearly shows that that this does have some health effects. So what they did next is the students were then able to isolate some of the key pollutants in the air and then map them to the human body, so we know exactly what is causing what. So if you look at the nitrogen oxide and the sulfur dioxide, that causes the airway, bronchitis, and increasing asthma symptoms. Now, it's important to mention the asthma symptoms, because one thing that we found was it's not that you have a lot of people having asthma, because that is something that, there are many things that cause asthma in addition to pollution. But I think what the main issues was the severity of the symptoms and the number of attacks that the children were having. That was the main difference that we identified within this zip code. So one of the action points that the students were looking at is that we can't stop them from getting asthma, and we had some asthma students in the class. But what we can do is look at potential initiatives that that kind of manage the asthma and the disease occurrence. What can be done to prevent having dangerous flare-ups and having so many so often? The lead was also a very big issue, as you can see on the diagram. So this diagram really is great at showing, how the pollution affected their body. And the next segment of the infographic just provides some information on how the children are affected. So lead poisoning, so we're getting 50% of Michigan's lead poisoning was in Detroit. So that just right there is an issue. So we do have lead issues from paints within the old houses, but we're also identifying lead coming out with emissions as well. So that's a big problem. Okay, so our third infographic is called A Breath of Fresh Air. So what this has done, what this group has done, is they pulled together a map which shows all the companies within the particular zip code, and highlight the proximity to residential areas. So where the blue dots are where people actually live. And so this is not all the companies. This is really just a snapshot of some of the big companies and some of the big plants. And this really points to the idea of the cumulative effect of the pollution on the neighborhood. And you can see straight away that there are lots of there's some very powerful and some very wealthy companies in that area, which makes it very difficult for the citizen groups to try and fight and enforce change. An example that was given recently was the Marathon plant expansion, and the idea was to expand the Marathon plant and to be able to process the coke oil coming from the Alberta. So the tar sands in Alberta are very difficult to process, a very difficult process to get the oil from there. So what Marathon were trying to do or have done is expand their capability so that they can take this tar and process it. Now the main issue with this is it required them expanding closer into the neighborhood, and it also is going to create some additional pollution because it's seen as a very dirty way to make oil. So there was a lot of issues with the community regarding the expansion, and some people on one side of the street received a buyout. So they were Marathon bought their houses at some people consider to be extremely low rates, but the company used the idea that well, we are giving you market rates for the value of your property in this neighborhood. Now the value of my property in this neighborhood is very low because of the factories, but the money that the residents who were given the buyout were given is not enough funds to allow them to move into another neighborhood in Detroit to buy a house. So that was the first issue, because people were very upset with the buyout numbers. And the second issue was that the way they drew the map around the area of impact was extremely sensitive. And you can have someone on one side of the street getting a buyout, and the people on the other side of the street had to stay and live with the plant expansions. So that created a lot of tension within the community. Other issues in the community is some of these plants have been known to basically take grants from the government for neighborhood job expansions. So the idea would be that we are going to expand and we're going to employ local people from the neighborhood to work within the factories. So lots of grants and money was given, But eventually what happened was that there were just a handful, if any, of people taken on those job opportunities, and most of the opportunities went to skilled people coming in from outside the neighborhood. So even though there's funding available to try and encourage job employment for people that live within this neighborhood, very few have seen the benefits of these kind of initiatives. So the pollution index, again, what the students in this group were doing, we're just trying to visualize where Detroit currently sits within the different pollution index. Again, looking at the ozone, the carbon monoxide, and particle matter and lead. And this picture really just it's very powerful because again, this is a picture taken by the students themselves when they were traveling to the Southwest Detroit on our bus tour, and they were very, very sensitive to try and avoid taking pictures of people who live there or of the children who go to the school. So you notice that all the pictures don't really have people in there. Now the boy with the asthma, with the inhaler, is really a prop because we did not take any pictures of the people in the neighborhood. The next item is really just showing a comparison of the different diseases. So if you look at cancer, it shows you Michigan rates of cancer and Detroit, and there's a lot of controversy at the moment about the impact of cancer in the neighborhood, and whether it's above average or it's on average, and which cancers are more severe. And I will say it's not conclusive regarding the cancer. On the other hand, the asthma, it's blatantly obvious that there is an issue with the neighborhood. It's obvious from the hospital administration, from the schools attendances, from the families where almost everyone has asthma. So the issue of cancer is very, very difficult to prove or disprove, and the literature that the students found, some of it was either way, depending on what kind of cancer you're looking at. And another issue with the cancer and the zip code is the information was very difficult to identify by zip code. So it was difficult to get anything concrete on cancer, but the students were very adamant on the asthma, and you can see from the infographics here that there really is it's a no-brainer. There is a huge issue. And if you look down, you see the infant mortality rates. So the yellow is Detroit average, and the green is national average. And it's obvious again that we have a huge issue. The pollution and the education and the income inequalities is really creating a situation where Detroit really can be considered to be a third world country, and in some situations a lot worse than a third world country. And it was said by one of the nurse practitioners that every pregnancy in that zip code is a high-risk pregnancy. So it's something that that needs attention, serious attention. So cancer rates by ethnicity, we can see that African Americans are more susceptible to cancers in the neighborhood in Detroit, and that could just be because there's more. But again, as I said, the cancer wasn't really it wasn't clear. It wasn't a clear-cut thing. Okay, so the next part of the infographic was really looking at the number of absence per student in the Detroit public schools per year. And in our neighborhood that we looked at, it was a lot worse than this. But this really, it does show you that there are there are serious problems with school attendance, and it's not always truancy, because we looked at some of the younger students, middle school, and there were a lot of the issues were sickness, so they were in hospital. And the graduation rates as well are a little bit lower than the national average for the area. If we look at the education level, people within the area, we again identify some challenges, and all these low education outcomes all have a strong contribution on the income that people are allowed to earn. So it makes it makes sense that the less educated you are, the less income, the less you are going to be economically mobile and get out the neighborhood. So it's a pattern, it's an unfortunate pattern that we see. And then we just finally hit the nail on the head when we just look at the income comparisons for some of the for this neighborhood. And I know it's 2010 data, which is could be seen as old, but nothing has changed. In fact, things have actually got a lot worse within that neighborhood. So, in conclusion, the pollution damages the health of the 48217 zip code due to frequent children illness. Children are missing school. There are no better paying jobs available, and unfortunately, the companies that create the pollution are allowed to continue to increase the levels of pollution in the neighborhood. While we were doing the research, there was a change in the law that allowed the emission caps to be increased, because the companies had been unable to meet the cap target for the past 3 years. Instead of enforcing the fines and enforcing changes within the processes, it was deemed economically prudent to increase those caps so that the companies are not burdened. So that was a very unfortunate decision that we had to hear about while we were doing the research, but that's politics in a way. So those are our infographics. So what can be done? That's the question. So one thing that we were able to do straight after while we were completing the research is, in collaboration with the Sierra Club, we were able to draft a letter. Let's show you the letter. Okay, so the letter was sent to the it's a bit slow, to the Department of Air Quality, and the idea was to make them aware of the issue of the asthma burden that's being presented in the epicenter in Detroit, and it was copied to the Director for Office of Enforcement and Compliance, and also to the regional EPA. And Dan Watt specifically received the letters, and they were all certified. And as an institution, we relied on the Sierra Club to be able to craft this letter in such a way that it would have meaning to the recipients, and it would also allow them to be aware of what we're finding, and also allow them to think about potentially understanding other alternatives. So what we did is the students were able to then disseminate this letter to other willing participants, and we ended up sending, instead of typical 5-6 letters, we probably ended up sending about 100 letters, signed letters from real people to Dan Watts, the Director for the Department of Environmental Quality. And I know for a fact that these letters were received, and I did get a response back saying thank you for your letter and the letters from your students. So he, out of all the letters, he identified that I was the professor culprit for some of these letters, and it was great to get an acknowledgement that the letters had been received, and I then got another letter saying that there was going to be an open hearing where they were going to review this, and the Sierra Club were then able to get a group together to attend that hearing and present the case. So we're still waiting for the results from that hearing. But the important thing to say from this, and from the students' point of view, is that they were able to make a change. They were able to bring this onto someone else's radar, who basically could action the item. Now, whether they're going to do something constructive or whether they don't have the political will to be able to make that change, that's out of our hand. But we did take it to a point where we forced a public hearing to happen on this issue. So that was very good for the students. It was nice for the students to feel that that their work was not in vain. It did have an impact. The second thing that came along from this was the lack of data for the area to be able to determine whether scientifically determine the incidence of cancer and asthma. It was a problem for us, so we moved it into another project where we had some of our master's students, some of our graduate students, in a statistics class, collect public available data and start crunching the numbers to look to see if there are any patterns or with cancer and asthma. Even though the asthma is very obvious, we still thought it's a worthwhile endeavor to create another project to actually look at this in a bit more detail. Another thing that was done is something called an asthma prediction and awareness tool. Now, one of the biggest issues from an economic point of view is this burden of asthma on the community and not being able to control or predict the incidence. So what we decided to do was create an app, a mobile application that collects publicly available data from Detroit and from Canada, and creates an algorithm that will be able to determine when a kid or an adult is most likely going to be vulnerable for an asthma incident and attack, and then warn them via a text messaging system. So it's important to say that this asthma prediction an asthma prediction tool does exist in some countries, and the technology to be able to create this is available, and the public available data such as your pollen, your weather, humidity and pollution level, that information is available as source. Getting it in real time is going to be the real challenge. But once we get that information in real time, and once we have people signing up, we will be able to make an impact by providing them with, number one, educational tips on how to manage the asthma, and then number two, predictions. So we'll be collecting data as well that's going to allow us to improve our prediction model. But we will be able to predict very, I won't say easily, but relatively non-complex models, be able to predict when someone is going to be vulnerable for an asthma attack. And what this will hopefully do is it will allow the parents to be more prepared, and hopefully keep the kids out of the hospital and allow them to actually get to work to improve their economic status. Another thing that we became aware of with this project is the lack of internet capability. So people in that community don't have a library, don't have a real community center, so they don't really have the means to get on the internet to actually look for jobs. So a lot of their jobs are word of mouth, and that come on the news or the radio. So one thing that would be a huge game changer is providing internet-based resources, a mobile a mobile lab that provides internet job search capabilities and things like that 1 or 2 days a week, because it's a lot of the students said really it would be great to have something permanent, but expecting people to come into this neighborhood on a permanent basis and live through this pollution is asking too much. So the idea of a mobile unit of some description that provides internet for some period of time and provides the ability for residents to be able to get counseling, job counseling, access to the internet, access to job searches, and create your resumes, that would be an excellent idea for that neighborhood. We did investigate that a little bit, and a couple of years ago there was a project that provided an internet hub. So it's called a mesh network. So a mesh internet network is when one person has the internet connection, and then you create a mesh network that allows other people within the community, in the neighborhood, to be able to access that network and that internet to get online and to surf and to look for jobs and get information on certain things. Unfortunately, when we went to do our study, that network wasn't functioning, and when we investigated further, we found out that there was a lot of mistrust within the community about sharing their internet connection with strangers. So the model, although the technological approach was sound, the model itself didn't work because of the social aspects. But it doesn't negate the fact that this kind of initiative is still needed within that community to be able to lift people out of poverty. So I mean, our recommendations for that would be to provide some level of connectivity to the neighborhood. And that could be done through either one of the community centers or just generally a Wi-Fi mesh network component, which the internet capability is not via a resident, it's via some other initiative. But we think, or the students really thought, that was something that was really important, just to try and lift people out of the poverty. So, and the other thing which they did was, create awareness of the issues. Now, what can be done, to really highlight some of the issues that are being addressed. Now, on the issue side, I think another problem which we identified was the lack of medical care. The people or the residents had to drive a significant amount to get to a hospital, and some of the community groups were requesting that they have some nurse practitioners who spend a day or two in one of the storefronts in the neighborhood, so that some of the older residents could receive care. But again, that's something that the availability of healthcare is something that we believe is very important, as well as availability of connectivity and the ability to to be able to deal and control the asthma are all things that we consider to be major findings from the study that the students undertook. I just want to show the slide that shows the major contributors. So these are the students that really got active in the project and pulled together the material. Altogether, we had over 28 students who were involved, who did the tour, and who wrote reports and reflections and brainstormed ideas and things like that. But the ones listed here are the ones that were very passionate and drove a lot of the work forward. And I was just the lonely instructor who guided them and watched them, and was amazed at how well and how passionate the students became once they took that tour with the Sierra Club. So I would like to thank the Rhonda Anderson from the Sierra Club, who who was an excellent host and educator for the students, and for the REI from MSU for providing us with this great opportunity to be able to learn so much from our community. Okay, thank you very much for listening. I'm just going to see if we have any questions. Okay, so we have no questions, so I am going to close this down. So thank you very much for your attention, and I hope you enjoy this webinar. And if you require any further information, follow-up information, or addresses for the infographics created by the students, please send me an email. My email is Polla, P-O-L-L-A, at madonna.edu. That's Polla, P-O-L-L-A, at madonna.edu. Thank you for your time.
Dr. Olla.
Hi.
Hi. Thank you. Wonderful presentation. Very, very good. I do have a few comments that I'd like to say here. First of all, I think this is probably one of the most unique projects or mini grants that we've been able to provide. Just the irony, I mean, our entire REI center is about economic development, and in the past, economic development has been about smokestacks, right, and helping companies to grow and become powerful economic engines, so to speak, right? So here we are talking about how these companies have been given more freedom to pollute more. I think that really bothered me to hear you say that the law had changed and we're not enforcing, you know, the law. In fact, we're making it easier for them. So this is, it's very depressing, actually. And I'm sure that a lot of the students thought to themselves, they want to leave Detroit altogether probably, or they want to leave Michigan altogether, and I think that's really awful. But and it's sad to hear that the people in that zip code really don't have the resources to leave, so they have to endure this. But it's great that you were able to get your students to think about maybe the action steps to changing things, and at the very least, the awareness that you were able to help maybe the community, and at the very least your students to have the awareness about it and to educate. That's great. And I have to ask the question, you know, where is the water in all of this? I mean, we're talking about air in that particular area, but we have a lot of water too. I mean, isn't the Detroit River right near there?
Yeah, so that's a completely different topic altogether. Yes, the water is an issue. Some of the pollutants are trying to create the idea of a green space where they're trying to clean up some of the water. But yes, the water in itself is very toxic. There were stories of that there's a particular green space in one of the pictures that we have on our Instagram, and there's a story that this used to be a very, because it's on an island, it was a very great ecological hub, and now there really is nothing that can live there, and how Marathon Plant is putting a lot of money and effort into trying to restore that greenland to get things to live there again. But water is another research project altogether.
Yeah, big one. So the EPA is well aware of this, and especially since you've written this letter and they were copied on it, but they're aware of the problems, and is there any effort being put into, you know, some great amount of funding or more research, or do you know of anything?
I think the research is actually very sound. The U of M have a very strong presence in that neighborhood now. They have a sensor van which is full-time in one of the car parks near the schools. So they're collecting a lot of data on the activities regarding the government and what can be done, it really is a balancing act, because on one hand you do want you want the companies to produce more and to do more because they pay more taxes, and on the other hand you do want to protect the environment. But I suppose who shouts loudest, the environmentalists or the capitalists? And it's, at this point in time, with the economy the way it is, it really is the companies who are getting the upper hands.
Yeah.
So and I think the issue is that it will require significant investment for them to be able to meet these limits that were set upon them. And their arguments are that these limits are unduly unfair, and they need to be addressed again. And that's really what happened. They were lowered. But I think there are lots of discussions going on. I'm still waiting on the outcome from the open session that was promised from the EPA.
Oh, this open hearing that you mentioned?
Yes, yes. So the open hearing, I think it happened. I'm not sure. I don't have the second letter, but it did happen either early this year or late last year, and they would review the data that's going to be presented. And I do have to say that the Sierra Club, who we worked with, have been very, very active in this, and the Sierra Club Detroit has been working with the National Sierra Club, and they've been providing some very strong evidence, and especially around the cumulative effects. So yes, one company might do 10, but when you have 10 companies, they're doing 100. So we're really trying to get them to look at everything, and even the case of there's a lot of research happening now suggesting that there should be a minimum distance between a factory and a school, because at the moment it's like you're sharing the playground with the factory.
Yeah. So
there's a lot of research going on by some very prominent Michigan researchers coming up with some policy ideas on how the closer you are to a factory, the worse your students are going to do. And that's a national study, and the evidence are compelling that it's a fact. Students who study near pollution or near to factories are always going to do worse than students who study in a greener environment. So there's a lot going on at the moment looking at this and trying to, I think the government's in a very precarious position trying to find a balancing act that protects the citizens and the environment, and also the big companies that pay the taxes.
So they may consider some zoning changes, or maybe the future master plan, if there is one ever?
The future, I'm sure the future master, I mean, everything's hindsight. So if we were rebuilding now, would we allow a school to go next to a factory, or a factory going next to a school? Probably not. Yeah. But is it okay to change it now? Can we come up with some initiatives to change some of these things? And again, the answer is probably not. Some of the areas that we looked at, the people had been given options, people close to the plant, the idea behind them moving was really they had no choice, because the amount of money they were given is just not enough to move outside the neighborhood.
Yeah.
But there are the further you go away, there are some neighborhoods where the people just don't want to move. When you move closer to Dearborn, there's some Arab communities that have lived there and are just comfortable living there, even though they know that they get sick, but they just won't leave those neighborhoods. So there are many factors in play. It's not just the government; it's the people. We need better ways to educate the people about some of the issues that they're going to be presented with over the next coming years if they stay there, and options for them to move. And options for them to have employment as well. So the employment options are very limited in that area, yeah. And the ability to move out is very limited too.
Right. Well, and these infographics are amazing. They really are well done. I mean, we've discussed using infographics here, and I don't know how they created these, but these are learning tools right here. I mean, I know that they're used on other projects all over the world right now, but the students, your team, could really use these in the community to help people to understand, and I think that's what you're doing. But
yeah, that's what, yeah.
Maybe needs more dissemination, and maybe we can help you through social media to get the word out. I don't know if you want the Madonna logo, you know, on these, or if you want your department, or if you, I don't know, because you'd have to deal with the response, but we could share these.
Oh yeah, I mean that's why the students were very excited about the RAI conference, because they have printed some of these, and we did use some of these in our research symposium. But they do want to have them distributed via social media, just to make people aware, because that was one of the big things, is awareness. It's all about awareness, and there's very little we can change. We can work on the asthma application, because they believe that is something that will be a game changer for people. But everything else is out of our hands. So the idea of creating these infographics that really break it down for people was one of the real big pushes from the student. So it would be fantastic if we can give you some links that you can share, even on the RAI website, associated with webinar and the projects. That would be fantastic.
Yeah, we should do that. And they're simple, they're digestible information in short periods of time, which I have to say, for a maybe lower educated population, they can quickly assess what is being said in that picture. And that's really useful. I can see it, you know, in literally paper handouts of sorts for the zip code that you worked in, you know, for them to understand everything.
That's a good idea.
Because they're not always using social media, and you're saying that they don't even have affordable internet, so they themselves may not see these as much as the larger population outside of Detroit, you know.
Yeah, and there are definitely some community places where we could definitely put these up.
Yeah. Wow, lots of information here, and very good project. I'm excited to have you guys at the summit. I think you'll be definitely popular, especially if we get the word out about, you know, what you've learned. And the Sierra Club connection, that's fantastic. I don't think we've had any student team working with such a, you know, big nonprofit that has done some great work. So it's good, all good.
Thank you very much. Thank you. Thank you for the opportunity to do this. I mean, it might not seem a lot to the big MSU RAI Center, but these really do have a big impact on the students and the work and their perspective of society that they're working in. So really, really appreciate this, and yeah, we need to get the message back to the funders that this is it's a terrific project that you do.
All right. Well, thank you, Dr. Olla, and I'll be talking to you sometime soon this summer or before the summit.
Excellent. Thank you very much for the opportunity.
Okay. Thank you. Have a good day.
You too.